Assessment of the older adult. For my assessment, I chose a female of 88 years old. Her general health history includes history of high blood pressure, in which she medicates with metoprolol as needed with symptoms, colon cancer 20 years ago, a back fracture 20 years ago due to a motor vehicle accident, and she has no allergies to any foods or medications. Her physiological assessment, mobility. This female is awake, alert, and oriented ×4 to person, place, and time. She's ambulatory with no assistive device or person assist needed, and she's able to complete her activities of daily living independently. Physiological assessment, the head, face, and neck. When inspecting this patient's head, she does have some hair loss due to chemotherapy 20 years ago, in which her hair never grew back in some places. She has no skin abnormalities, moles, acne, wounds. Her strength and muscle tone is normal and equal in all 4 extremities. Her pupils are equal and reactive to light. She has no wounds or bruising. Her carotid pulses are present at 2+, and her vision is good. The patient states that all she needs is reading glasses intermittently, but no prescription eyeglasses. Her physiological assessment of the chest, abdomen, and back. In these areas, there were no skin abnormalities found, no wounds, bruising, acne, moles, etc. Her heart sounds are normal. S1, S2, and S3 have been heard. No murmur or gallop. Her lung sounds are clear in all lobes with no signs of diminishment. And her bowel sounds are present in all 4 quadrants, normal. No hypo or hyperactive sounds noted. The physiological assessment of her arms, legs, and feet. When inspecting this patient's skin, there were no abnormalities found, no wounds, bruising, acne. The patient has no edema. Pedal pulses were felt and present at +2. Her radial and brachial pulses were present at +2, and the capillary refill of both her upper and lower extremities on all fingers were less than 3 seconds. Her nails showed no signs of discoloration or clubbing. Psychological assessment. As I stated before, the patient is awake, alert, and oriented to person, place, and time, with no signs of decreased cognitive function. The patient states that I feel energized throughout the day. I am able to cook, clean, and take care of myself independently with no issues with mobility. The patient lives alone, as she was widowed over 40 years ago, and hasn't had anybody like an assistive aid or anyone coming in to help her other than her family with larger tasks that she might not be able to complete. The patient reports no feelings of depression and has not been diagnosed with any psychological issues. The patient does state that she has periods of anxiety where she becomes very nervous and gets short of breath. This happens with triggers and sometimes without known triggers. Her social assessment. The patient states that she is very social and meets with friends frequently throughout the week. The patient also states that she spends a lot of time with her grandkids and her family. Her son and grandkids live about 3 minutes down the road, and she has very close friendships with her neighbors. The patient does continue to drive locally. Her spiritual assessment. The patient states that she joins her local church's live stream once in a while. She reports being Catholic and feels close to her faith. The abnormality in her assessment that I chose to focus on was when she stated that she feels anxious quite often. The possible causes of this or triggers could be living alone, since she did state that she was widowed, her increasing age, and the fact that she stated that she has some unhealthy family members that she feels responsible for. This impacts her life in a way that makes it difficult for her to function when her anxiety is really bad. She states that when she gets like this, she feels physically sick and cannot focus on anything but feeling nervous. Sometimes the lingering feelings of anxiety can last for minutes, hours, to days. Is this patient healthy? Overall, I deem this patient to be holistically healthy. She's 88 and completely independent with no major health issues. Recommendations for this patient. I recommended that she continues to be active and social as she has been. At this age, it is very important to continue to get out of the house and do as much independently as possible. She should find someone to help her with her ill sister and brother-in-law, as she is most of the times responsible for driving them to doctor's appointments locally and for checking in with them. She often makes sure that they have dinner and visits them quite frequently throughout the week. For my teaching plan for her, I came up with the client goal that she should continue to be active and the goal of decreasing her feelings of anxiety. When looking at her physical assessment, I came up with a physical goal for her to continue to be as active as possible in her activities of daily living. When it does seem overwhelming, she should call a family member for help so that she doesn't harm herself. According to an article by the CDC, adults age 65 and older need at least 150 minutes a week, for example, 30 minutes a day, 5 days a week, of moderate intensity activity such as brisk walking, or they need 75 minutes a week of vigorous intensity activity such as hiking, jogging, or running. While she is healthy, it doesn't seem like she'd be able to go for a jog or run, but walking seems feasible. I recommended for her to take a 30-minute walk each day, whether she does all 30 minutes at once or breaks it up throughout the day, for 5 days out of the week. It is also recommended by the CDC that somebody over 65 years old spends at least 2 days a week on activities that strengthen muscles. It is also recommended to perform activities to improve balance, such as standing on one foot about 3 days a week. I gave this recommendation to her of improving her balance by standing on one foot about 3 days a week as well. Psychological goals. When relating this to her one psychological issue, I recommended that she calls family, friends, or anybody that she can when she has feelings of anxiety. This can offer her the social support that she needs in order to work through these feelings. I also recommended that she talk to her doctor about these feelings and work on coping mechanisms for anxiety. According to an article published by Healthline, some coping mechanisms recommended for anxiety is to question your thought pattern and find your triggers, perform deep breathing exercises, utilize aromatherapy, go for a 15-minute walk, and to identify the triggers of anxiety. Physiological goals. I also recommended to her to make and maintain meaningful relationships as recommended by an article published by McMaster University. As this article states, research evidence shows the importance of social networks, which include family, friends, neighbors, and community members. Even casual conversations with strangers can fulfill some social needs of older adults and contribute to their well-being. This patient states while she spends a lot of time with family, she is also close with both of her neighbors. She meets often with them for dinner, whether it be at her house or theirs, or just for a cup of coffee on the porch outside. These types of conversations and social meetings can improve social morale and work closely to maintain the goal of having meaningful relationships at this age. Cultural goals. The patient says that she feels that her faith and culture is integrated adequately in her daily living. The goals I gave to her were to continue to integrate your faith into her daily living, such as meeting on her live streams and talking to people about her culture and faith, and continue to attend in-person church meetings. This will help promote not only her culture and faith, but also her social interactions with others. My teaching plan. The teaching plan that I recommended for her was to create a weekly plan or journal to schedule her goals for the week. This will act as a motivator to complete tasks and also help her keep track of her goals. Evaluation plan. I recommended that she keep this journal for about 2 weeks independently. After those 2 weeks, we can check the journal together to keep track of the patient's goals that she is hitting. If for some reason we notice any sort of pattern of goals that are not being met, we can evaluate why and reform those goals to make them more attainable. We can also look at patterns of goals that are being met and use those to motivate other goals and reform them into more attainable goals. Here are the references that I utilized to complete this presentation. I also share these references with the patient that I assessed in order to give her some more educational material on creating meaningful goals for someone of her age. Evaluation of the journal. While it has not been a full 2 weeks yet, I assessed the journal that I recommended in my teaching plan that the patient has been using to set and keep track of her goals. We found that most of her goals were attainable, and she did state that the journal is a great motivator and something that gives her positive recognition for hitting her goals. She will continue to use this journal for as long as it stays positive for her.